Hey there, Dr. Natalie Azar here from NBC News. Here to answer your questions on the coronavirus pandemic. I think the word on everybody's mind right now is probably masks and whether or not we should be wearing them in public. And we are anxiously awaiting a formal recommendation from the CDC on this. So I think it's just important to kind of put it into context to think about what we're actually talking about here. Have we changed our perspective on masks actually preventing somebody from getting infected? And the short answer is no. That it is still thought that the primary reason for the general public to wear something covering their mouth is not so much to protect themselves from getting virus in, but rather to protect everybody else. So this sort of idea of I do something that protects you and you're doing something to protect me. And where this comes from is this concept of asymptomatic or pre-symptomatic transmission. Everybody, I think, feels comfortable with the idea that a cough or a sneeze could contain respiratory droplets that house the virus and that that's how it can be transmitted from person to person. And so by wearing a barrier, you protect yourself. And of course, for healthcare workers, wearing an N95 or a surgical mask, or I should say just an N95 can prevent the virus from gaining entry. So yesterday, the National Academy of Sciences released a report citing several different lines of evidence from the New England Journal to some data from the University of Washington, some data out of Wuhan, and also some data out of Hong Kong that basically said that the available studies now show that, in fact, the virus probably can live in a little aerosolized mist, if you will, that really can be generated just by breathing or talking. And so because of that, should the general population now be wearing a mask to prevent spreading it to others if you don't currently have symptoms? And I think at a minimum, we're going to see that the recommendation will probably be for those of us who live in a hot spot to be doing that. But I think it makes some rational sense that perhaps the general public should be doing that. Because as you may recall, we're always a couple of weeks lagging in terms of the outbreak and the numbers from where we are right now. So if you're living in a part of the country that isn't having a lot of cases right now, that could change in the next 2 to 3 weeks because there is that lag. And so if we can kind of intervene in those places and not get behind the ball like we were in New York, for example, or New Orleans, maybe that could make a difference. Now, importantly, this is to be used in conjunction with the physical distancing and in conjunction with hand hygiene. It's not to replace it. And I think the biggest concern that's coming from, the White House, as Dr. Birx said yesterday, is that people shouldn't get a false sense of security that if they go out wearing a bandana over their mouth or in their nose, that they are protected and that they should also then, still be aware to not touch their faces and all of that kind of stuff. So we'll see what they say. But again, I think that recommendation will probably be forthcoming in the next couple of days. Okay, so let's see. I have a lot of people, symptomatic, explain, please. So I'm assuming that means that the difference between symptomatic and asymptomatic transmission symptoms, obviously to be aware of, are coughing and sneezing. But those folks, or I should say, we now know that a good percentage of people have been able to transmit the illness and have not had any symptoms like that. So we believe that just literally breathing or talking in close proximity to somebody could result in somebody else getting infected. Pharmacy, am I going to get pulled over when I drive there? Pharmacies are still considered essential businesses, as are, food supply and hospitals. And so unless there's anything different about your local jurisdiction, that is still an allowable reason to go outside of your home to do those essential things. I like that. Masks for all to keep the community healthy and not overwhelm the healthcare system. Well, yeah. And I should also say that, some hospitals in New York City are starting to see, lessened numbers of patients getting admitted. We're still at full capacity in a lot of hospitals, but the hope there is that some of the social distancing measures have actually helped a little bit, and that maybe we're starting to see a little bit of a shift or the tide turning, although way, way, way too soon to call it. But if you can imagine, if we added on top of that, potentially limiting asymptomatic transmission in addition to the social distancing, that we could really start to get to the peak earlier and to the other side of the curve, which we need to be. Do I get a mask? Yeah. No bandanas either. So this is the good news about this, is that in fact, officials are not saying to run out to get a surgical mask. For this purpose, for acting as a barrier, you can use cloth. People have repurposed bras, underwear. In some of the studies that were done, they used 3 layers of paper towel. So really something with, the thicker the better, one would imagine. But again, this is not to protect you. It won't do anything if someone coughs into your face. A surgical mask won't even help you. Maybe it's better than nothing, but that's not the point of this. The point of this is to literally act as a barrier to try to trap the aerosol and trap any respiratory droplets so that you're not infecting other people. So you could literally put a scarf around your neck also. But I like that. You said you're a cowboy, but you don't have a bandana. Right. So again, it's not about the masks. And I think that was one of the big things that you'll notice that they aren't calling them masks. They're calling them face coverings, because it does not need to be a mask. If you have a surgical mask at home, yes, you can of course use it. But it's not about having a mask. It's about covering your face. And if we do get to the point where they are making a recommendation, I hope that they're very clear about what works and what doesn't, because I think a lot of people are going to want to know if something they have at home could be used. Yeah, page on Google. I know, the underwear. I heard that also. And I think the New York Times, I didn't even have a chance to read it, but I think the New York Times also has some how to do it yourself. And I think The Guardian had a good article on that too. Let's see. So again, I'm going to reiterate a lot this idea that it doesn't need to be a mask, because one of the biggest 2 things I think that the White House and Dr. Birx were very clear about, that they were concerned about this recommendation for people to suddenly cover their faces, is number 1, that we don't want to start hoarding or start taking away from the healthcare workers' supply. That is of number 1 importance, as you can imagine. And that number 2, that it doesn't give people a false sense of security. I'm going to reiterate that for folks who might have just joined, that wearing something covering your face does not mean that suddenly you don't have to socially distance or wash your hands. That's incredibly important. And another note to make is that it's supposed to cover the nose and the mouth and the chin, but your eyes are still exposed, obviously, because you have to walk around. And we know that some cases of coronavirus or COVID-19 does present with conjunctivitis. So you can introduce the virus into your body via your eye. It's not just your nose or your mouth. So again, if you're outside wearing a scarf or a bandana and you start rubbing your eyes, you certainly haven't protected yourself in that scenario. Yes, Oh, great question. I'm glad we're still getting the NSAID question. This was a viewer who asked about whether or not they can take Aleve, which is naproxen. And the answer is yes. After the French health minister tweeted a couple of weeks ago about the potential danger of NSAIDs and COVID-19, both the FDA and the World Health Organization reviewed the available data and said that there was no compelling evidence that NSAIDs could exacerbate COVID-19. And the recommendation, therefore, is that people who take it intermittently for certain things can certainly continue. People who take it regularly for arthritis and other conditions don't need to discontinue because of this concern. Although I will make one little sidebar note, and that there has been some recent literature that hypertension can be a risk factor for a bad outcome in COVID-19. And we know that NSAIDs, if used inappropriately, can raise blood pressure. So that doesn't give a green light for everyone to start using NSAIDs. We know that they can be associated with a lot of different potential side effects. But acetaminophen, of course, can also be used and should be used for a fever reduction as well. Can it be transferred to you from somebody's clothes or hair? So those, both clothes and hair, are not hard surfaces the way stainless steel and plastic are. And those are the surfaces that the virus tends to be most stable on and can survive the longest on. So yes, theoretically, it could be transmitted through other material like clothing. but we don't know how long it survives there. So if there is a concern or you are a healthcare worker, I think most people are, when they come home at night, they're putting their laundry in a separate bag and washing it, after a few days or after they, not in the same cycle with other folks and not touching family members with their clothing. Yes, you can get it through the eye. The eyes and the nose and the mouth are the portals of entry in the face. And so again, if you're wearing a face covering, but you touch something and you rub your eyes, you can introduce it to yourself. So when we say don't touch your face, we are including the eyes on that. Okay, don't hurt anyone if they cough in your face, although I know that would be an instinct. Yeah, I know the failure to expand Medicaid has definitely been an issue. That's definitely not a good thing. Let's see. Let's get some more questions. You guys have good comments, that's for sure. Let's see. The other thing that was kind of newsy today, that was interesting, was about whether or not the projections were accurate coming from the White House this week, the 100 to 240,000 deaths. And this, I sort of said, there's a lot of very nuanced and important statistical and epidemiological nuances to that story. But suffice it to say, I think that models are just that. They are models, and they are only as good as the assumptions that they're based on. And many of those assumptions have to do with how contagious and how deadly, the virus is. And those numbers have also been a little bit fluid. So, we'll wait to hear and see if anything in that capacity changes. But according to most statisticians, they really say the purpose of these projections is that there should be a coordinated response and reaction to that. So that's, of course, where all the guidance would potentially come from. Let's see. Oh, that's interesting. Yeah, someone's husband is a doctor, and they said everyone's going to get it. I mean, we will definitely see what kind of numbers once we can actually start testing the general population, which we still don't know when that's going to happen. We're still at a place where we have the commercial tests, the swabs that take a few days. We have the Abbott test, which is 5 minutes, that I am fairly certain is not, widely distributed yet, of course. I think that takes a little time to get that up and running. And then, of course, we have the antibody test or the serologic test in the blood, which is not yet commercially available. But I tell you that as soon as that's available, that's, we will all be lining up to get tested to know if you've been exposed and to know whether or not you're immune. There is no current evidence that this is mosquito-borne. So hopefully that doesn't change. Okay. I know that would be amazing if we could get the vaccine sooner or later because, experts definitely do say that we will probably be dealing with some sort of social distancing or physical distancing until or unless a vaccine is ultimately developed or the therapeutics are better. So we'll see whether that happens. Breathing exercise expand the lungs if you're exposed. That's a really good question. Yeah, I think respiratory therapists do have breathing exercises for folks. Obviously, there's the incentive spirometer, but I don't think most people have that at home to breathe into. Yeah, so back to that original question about isolating a family member. If you have the space in your home, the recommendation is to have an infected family member in their own quarters, in their own bedroom, and having only one household member be the designated person to take care of the sick one, wearing gloves when interacting with that person, washing hands pre and post glove wearing a mask. Ideally, the person who's sick would also have their own utensils or use plastic utensils until they are better. And the recommendation right now is that you need to be symptom or fever-free, I should say, without fever reducers for 72 hours and have most of your symptoms resolved and be at least 7 days from symptom onset at this juncture. So there's no evidence right now that COVID-19 is causing disease in animals. There was the anecdote of a dog that tested positive in respiratory secretions. But at this point, there's, again, no evidence that humans can transmit the illness to dogs, let's say pets, or the other way around. Work together and listen. Okay. Walking alone on the beach at night. I would not worry about COVID on sand. Alcohol definitely works as a disinfectant. 60% alcohol is the recommendation for hand sanitizers, at least 60%. So the insurance question is important. And I know that at least, Medicaid and all commercial insurances are waiving costs, but I don't know if you're paying out of pocket how that would be addressed, honestly. That's a really good question. You're welcome. I appreciate you saying thank you. Yes, somebody with COPD and on steroids, there is a higher risk of complications from COVID-19 based on both things, based on having an underlying lung issue and based on being on the prednisone. So please, please, please take care of yourself and really limit contact with the outside world for a little while. That is really a good question, to continue to use the N95 if you're using it at home. I mean, basically they say that if it's soiled or damaged or wet, that masks are no longer good. And I know that there's been a lot of different companies who've been racing to try to get an N95 sterilization process approved. So I would definitely try to maybe contact your local Department of Health and get guidance on that, or go to the CDC website and see if you can get guidance on sterilization, because I know that different universities have actually been doing different things. They've been using like an aerosolized hydrogen peroxide solution, that kind of thing. Probably if it's just you wearing it, you're not wearing it in the hospital. I'm sure that it's probably still good. The concern about reusing N95s is obviously because they are, they're actually being exposed to virus. Let's see, being diagnosed with pneumonia. How do we know that they don't have coronavirus? So the issue with pneumonia, coronavirus starts off in the upper airway. So it starts off in the nose and in the mouth. And then in unluckier individuals, it starts to travel down the airway into the lungs, where it can cause pneumonia. And according to radiologists, it has a fairly distinctive pattern on CAT scan, that in most cases, given all the other, clinical data, that a doctor could make a decent presumption that somebody has COVID-19 pneumonia as opposed to another type of pneumonia. But I would imagine that by the time somebody went so far as to get a CAT scan, they would probably be able to be tested to distinguish, as treatment would be vastly different between that and a bacterial pneumonia. The other bit of interesting news that has come out recently, although it hasn't been necessarily validated, is that that the picture may not look like a classic ARDS picture necessarily, although again, that's not been totally validated, but it does explain why some folks are having a worse outcome than would be expected, because it might be behaving differently in the lung than we initially thought. But we're not seeing as much bacterial pneumonia with COVID-19 as we do following influenza. I have not been going to a salon. I did my own hair. Thank you. I heard it was in air. Okay. So that's the issue right now, is that there's been this debate literally for weeks or months almost about whether or not it's airborne. And airborne is a terrifying word. I understand that. Right now, I don't think there's any evidence that it's airborne the way measles is, where it can literally linger in the air for hours and still infect somebody who has left, someone who's infected leaves the room, and then someone who's not infected can get infected hours later. There has been definitely research that shows that the viral genetic material can be found in rooms hours after the person was in there. But to my knowledge, there's been no evidence that that virus was actually infectious, that was able to actually, grow in a culture. that it was just the genetic material, but it's still evidence that we know that the virus can be transmitted if it's in a tiny little aerosol coming from talking or breathing. But whether or not it can linger in the air for hours and hours, I don't think that we know that yet for sure. But hence the recommendation potentially for the face covering. It's 100%, well, not 100%. It's definitely possible to have COVID-19 without a fever. Yes. There's no evidence that freezing packages kills it, but I don't know that there's any evidence against it. Heat definitely can kill it, but I'm not sure about freezing. Hydrogen peroxide, yes, can be used as a disinfectant solution. I think it's a 0.5% solution. And for bleach, it's a 0.1% solution. CDC has recommendations for making your disinfectant solution at home. Yeah, the issue of cleaning masks is really important. I know that the N95 website talks about bleach solutions, and I also know that different universities, I think Duke universities and some others, have devised different mechanisms and processes to clean the masks. And some of them do use like an aerosolized hydrogen peroxide, so you can certainly look into that. I think if you do it yourself, you just don't know if it's adequate or not, but it's probably better than nothing. How long masks are safe is really difficult to answer because we don't know how long. I wouldn't know how long a mask was safe that you're using every day in the general population because we don't normally do that. The CDC has a very specific section on their website about limited reuse and extended use of masks in the hospital setting. But again, that's in the hospital setting where there's much more potential for contamination and everything like that. So it almost doesn't even apply to people using their own masks at home. I am fairly certain, if my journalistic instinct is right, that as soon as a recommendation is made about the general public wearing a covering, they're probably going to also give us tips on how frequently those things should be cleaned. And certainly if you're using a bandana or a scarf, those things can be laundered in hot water. Why does it, if it, other than, yeah, that's a great question. And it's, we know that in 80% of folks, it's supposed to be mild and moderate, and everybody is comfortable with the concept that people who have a compromised immune system or older folks have a potentially worsened outcome. I think that's all very intuitive for a lot of people. So why is it that somebody otherwise young and healthy can get so sick? I think the short answer is that we don't know. Part of it has to do with viral load. So healthcare workers who are doing or participating in what are called, super spreading events, that is intubating, extubating, respiratory therapists doing BiPAP and things like that. Those folks are at a much greater risk for having a severe disease because they're getting a lot of virus exposure. Why a young person otherwise who's not, a healthcare worker could get really sick? Well, we know that people who are otherwise healthy can die from flu. And you say, why in the world could that happen? There is, for some people, the reason that a virus or an infection kills them is not specifically directly from the virus invading the lungs and causing heart failure or something, but it's rather the over exuberant immune response to the infection. That's called a cytokine storm. And when that happens, it can result in septic shock and multi-organ failure. And we do know that from flu that is the cause of death in a lot of people who are otherwise healthy. And so that would be the hypothetical explanation for that happening in COVID-19 as well. Acute asthma, anybody with lung disease, underlying lung disease is theoretically at greater risk for any respiratory pathogens. So just please make sure your asthma is well controlled and be hypervigilant about hygiene and all of that. Yes. That's a good question. And I don't know specifically, they're talking about Japan 2016 coronavirus. I'm guessing is that if it wasn't as large enough of an epidemic and certainly not a pandemic, that there was no incentive for vaccine development. and go out, different pleural and COVID? Do you mean pleural fluid? I don't understand the question. I'm sorry. If an adult in their 50s is told RSV, could it be COVID-19? That's a good question. I'm gathering that it's fairly difficult to tell the difference between any respiratory virus early on. As we know, we've talked about this a lot with colds and flu and COVID-19. But I think once and if the COVID-19 presents in the lung with pneumonia, it has fairly characteristic findings. I'm sure they could probably tell the difference. And I think it's pretty easy to test for RSV also. Okay. Yeah, I mean, the issue of killing off, good things, I think is a point well taken. Somebody says using too much hand sanitizer. And, just to be clear, I think most health professionals and CDC and WHO say that if you can, wash your hands. And if you can't, use the hand sanitizer, and you can use the hand sanitizer as an adjunct, but it's also very drying and very irritating. Yes. Okay. Yes. Asthma. What are the beginning symptoms? We thought we knew this. Some of the earliest series that studied patients out of China described, and also some more recent ones, described a very typical sort of slow viral type syndrome of symptoms, which is achiness, fatigue, lethargy, maybe a low-grade fever, and that would then escalate to shortness of breath and trouble breathing in people who got really sick. But now, of course, the more we study this, the more we realize that, number one, you can have no symptoms. Number two, half of those presenting or half of those patients ultimately with respiratory symptoms actually had GI symptoms early on. So I don't want to say anything goes, but I think at this point, given that we're still learning so much about the disease, that if you're sick, feel achy and you're coming down with something, I think it's not easy to say one way or the other early on. I would say the most characteristic symptoms, of course, would be a dry cough and fever. That, as it is a respiratory infection, but it's certainly not 100% of the patients. So heat killing it and dying out in the summer. I don't think there's any expectation that it's going to go away completely in the summer. I think based on what Dr. Fauci has said is that what they are seeing in the southern hemispheres, that the cases are now starting to increase as the southern hemispheres are entering into their winter months, is that it's starting to, or it probably will be behaving like a seasonal bug, just like the regular cold is seasonal, right? We have a season where cold is very, very common. And then you can get a cold all year round, but we know that it's like fall, winter, spring is when people mostly get it, and the same with flu. So I think the expectation from the CDC is that we will see a dip, hopefully, a decline in cases as the weather warms, only to have it probably come back again next year. But the silver lining there is that by then, testing should not be an issue anymore. There should be point of care testing. There should be, swabs in the doctor's office, just like you go to get checked for flu and you sit there and you wait. If you go there with your kids to get checked with flu, you wait 15 minutes and you get an answer. We should have that all good to go. And we should also have the antibody testing so that if you've had it before. And we're hoping if it doesn't mutate, that if you have been exposed, you will be immune for a period of time. How long, nobody actually knows. If it does come back next fall and winter, we won't have a vaccine yet, but hopefully the season after, if it's still around, then we would definitely will. So, that's a good idea. The mask in the dryer. I know they say like a 45-minute dryer cycle is good for clothing to kill the virus. So anyway, definitely worse for smokers. That was originally from the original cohort in Wuhan. It definitely affected the men more, and that was thought to be associated with the higher rates of smoking there. But smoking, of course, as it compromises your lung, makes you more susceptible to respiratory infections. Let's see. So we're addressing so many questions. It is very scary if you have autoimmune disease and underlying lung issues. And, sometimes I think we try to do a good thing by keeping everybody informed, but the 24/7 news cycle can be terrifying also. Just know that the numbers still comparatively to the whole world and to the country are low. And so if you stay home and you try to protect yourself as much as possible, the greatest likelihood is that nothing will happen to you. But better to be a little bit scared into protecting yourself than being too complacent. I'm trying to look at the cup half full there. No, there's no evidence. There's no recommendation thus far to the question was, should you cover your hair? No, it's the nose and the mouth and the chin when you're out. Oh, good. Thank you. Well, you're welcome. Let's see. Clear info. Thank you. You're very welcome. Oh, how common do you think asymptomatic COVID is? Well, some reports are saying 25% of cases, and then in other like little clusters throughout the world, it's up to 50% of cases have been asymptomatic. I don't think we're really going to have a great idea until all data from every country can really be analyzed. I think we're getting new information every day, but it's not a small number. It's a pretty high number. Let's see, type 1 diabetes. So I think with diabetes, the issue is not about whether or not you have it, it's how well your sugar is controlled. So if your A1C is good and your sugars are controlled, you're not considered to be in the highest risk category. Poorly controlled hypertension, poorly controlled diabetes, advanced heart disease, lung disease, those are the medical conditions that can increase your risk for a bad outcome. Hydroxychloroquine, here we go. There is a shortage already. And many rheumatology organizations have voiced their concern and released a statement on this, discouraging inappropriate prescribing because of this, and certainly hoarding. There are multiple centers, I think, that are enrolling patients in clinical trials. I know my institution is, both to see whether or not pre-exposure prophylaxis works, post-exposure prophylaxis, whether or not it works in mild cases, and whether or not it works in severe cases. There was recently a second report or study out of China that did suggest that hydroxychloroquine lessened the severity of disease. I think improved CAT scan outcomes compared to controls, and also that in the two groups of patients, hydroxychloroquine and in the control group, only folks in the control group who weren't on medicine needed ICU or intensive care. So again, smallish study, but as soon as we need to compile this information so that we can make an evidence-based recommendation. And I know I haven't checked in on this in a while. We have a running tally of pharmacies in my group that are still have a good supply of Plaquenil and hydroxychloroquine for our patients. Thus far, knock on wood, I haven't had a patient not be able to get it, but it is an absolute concern for them and for us, as it is a life-sustaining therapy for lupus patients. Yes, you can have symptoms without fever. In different studies, close to half of patients did not have a fever. If you have a respiratory issue, if you get sick, where should you go? That question to me is pretty obvious. If you're having trouble breathing, you're going to an urgent care or an emergency department. Ideally, calling your doctor first, or if there is a virtual urgent care that can triage you, please seek that out and use that. Vitamin D. The vitamin D story is kind of interesting. I think there's a lot there in terms of that vitamin D is important for patients' immune systems. I think there's certainly no harm in either having a vitamin D level checked or maintaining a level, an adequate level during this time. I don't think it's going to be a cure, but I don't think it'll hurt. I sort of am getting this question, a weird situation because you have throat hurt all the time and cough all the time. I would say a worsening in baseline symptoms or a change in baseline symptoms or anything associated with fever and shortness of breath should alert you to reach out to your doctor. Okay, will we have to isolate this summer? Maybe. I don't know what's going to happen. as Dr. Fauci always says, we don't necessarily make those guidelines. The virus is going to make those guidelines or inform them. I don't think that we go from 1 week of, stay at home to the next week, everything's back up and running. I think it's going to be a phased in, nuanced reentry into life with potentially staggered commuting and staggered work schedules, more flexibility on the parts of employers and work from home options. And I think, and then see, because the last thing in the world you want is to go through all of this and all of the economic, as well as health outcome hardship, only to have it bounce right back up if we let down our guard too soon. Interesting, sneezing and headache wasn't part of the earliest case series as the most prominent symptoms. But at this point, I think given that there's a lot about the virus that we don't know. Uh-oh. Oops. Oh no. Sorry, that was my phone. I think at this point, if it's just sneezing and a headache, maybe with, some watery eyes and it's allergy season, it's probably that, but just keep an eye on and be aware for the development of dry cough and fever. Okay. Let's see. All right. I think I'm probably going to stop now. That's been about 36 minutes. Any evidence the virus might have been in the U.S. before January? That's a great question. I know that I think it dates back to November or December in China, but I don't know that there's any evidence of that here. Although remember that we always say there's at least a few week lag before the first cases are diagnosed. So I think that probably puts us safely in 2020 for new cases in the US. But certainly once this is all really dissected and studied, we may find out that that wasn't the case. Okay. This question specific. I would like to hear the answer for rural versus, I don't think I got that question. New orders here in LA. Yeah. So the answer rural versus versus urban. I think the question is about wearing face covering if you're just in a hot zone versus everywhere in the country. And I think we're going to get guidance on that, hopefully a formal guidance from CDC in the next hours to days. I think at a minimum, the recommendation will be for hotspots. The issue here is that now that we all probably feel comfortable enough that there is asymptomatic transmission, let's say you're someplace rural in the country right now that doesn't have a lot of virus, as far as you guys know. Well, in 2 to 3 weeks, that could all change. And the whole idea here is, can we learn now that we know this? Can we learn from that? Can we not have a New York problem or a New Orleans problem popping up in other areas of the country, and especially other metro areas? And I think the answer is yes. I think that the combination of the social/physical distancing plus potentially the face covering to protect your fellow Americans could make a difference. And so that those other places in the country never get to that high peak, that they have a flatter curve the way California did. Lots of in and out meds that make it worse. So right now there's no FDA approved treatment for this. If you've been following the news, you've heard about the hydroxychloroquine story. There are multiple studies that are addressing this right now. And as soon as we have more definitive data, certain things could become standard of care. Right now, for most of us, the patients who are being treated with antivirals or different immunomodulatory drugs are doing that as part of a clinical trial, which is great, so that we can get information that will inform guidance in the future. Okay, that's it. I'm going to end. I'll be back next week, maybe same time, same place. Everybody stay well, wash your hands, and let's wait and hear together what CDC says about face coverings. Have a great day.